Welcome back to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. Great way to kick off the new year, 2021, to be able to thank Christian Shalgian, our director in Washington, D.C. for healthcare policy, to let Christian tell us about the success that our fellows helped our patients realize through Christian's efforts and the efforts of his entire team. So thank you, Christian, and welcome.
Thanks, Dr. Wexner. It was a fantastic year last year. A lot of work done on a lot of people's parts. The Medicare had planned to make significant payment cuts to many physicians, including surgeons, on January 1st. And as you and I have talked about on a couple of different occasions last year, we did some great work, and the fellows really engaged in the effort, and we were able to stop those cuts from occurring. So for all intents and purposes, the cuts were stopped, which was the goal the whole year, to make sure that those cuts didn't go into effect and negatively affect patient access to care. So that was really a great year.
Just to give people a reference point in case somehow somebody's just tuned in and wasn't aware, just review for us, please, the amount of, or at least average among specialties, of the cuts and what the result was at the end of 2020.
So Medicare had planned to give primary care a fairly substantial increase in their payments, in their Medicare payments. And because of the budget neutrality rules, that would have resulted in somewhere between a 5 and 10% cut, depending on your surgical specialty, that you would have been facing on January 1st. We were able to scale back that primary care increase that they were going to get, but yet also get Congress to put in some new dollars into the system this year. With the COVID crisis and the like, it didn't make much sense to cut physician payments on January 1 with everything that this country is facing. So, I equated it to, you don't cut soldiers' pay in the middle of a war. This is what we're in right now, and the idea of cutting payments to physicians was not going to be appropriate. So we marshaled the forces all year long, both from a lobbying perspective, from a coalition perspective. All the surgical groups came together and did some amazing work. But I would still say that the most impressive work was done by the fellows of the college. I've been at the college now for almost 22 years, and the involvement that I saw last year of fellows who were writing their members of Congress and making those phone calls, that was some of the best numbers that we've ever seen. And candidly, it made a huge difference with what we saw for the success for this effort. And so I think that was probably the most exciting thing that I saw as part of this campaign.
Now, the campaign was, I think, from what I understand, kind of unprecedented in two regards. Firstly, the number of our fellows who actively participated, and secondly, the surgical coalition and the activity of the surgical coalition. So we now have marshaled a very active and engaged group of people, ACS and allied groups. So I guess it's a two-part question. The first of which is, for how long have the cuts been stayed? In other words, at what point we need to resume or continue action? And then secondly, how do we keep the momentum from these groups of individuals going forward to achieve that goal?
So the first part of that question, the cuts, about half of the cuts were done away with for just 1 year. So we're still facing a cut come January 1, 2021. So we've got some work to do in that regards. So I want to make sure that fellows know that this is a 1-year thing. We're going to need to be engaged in this effort going forward. Your second question?
Well, the second question relays that, so we have a group of people who've been participating to a fairly unprecedented, or perhaps totally unprecedented, level of engagement, writing to folks on the Hill to help maintain access for our patients. So this group has been marshaled. They're very well aware of the success which has just been had. What do we need to do to keep it going, to avert this, just kicking the can down the road, having the same problem in a few months?
So part of the challenge that we have this year is the fact that we have a brand new Congress, and there are a number of new members of Congress who are coming in. We have to do some education work in that regard, and so we're going to need fellows to engage their members of Congress. letting them know the fact that thanking them. First thing you got to do is say thank you. We want to develop that relationship. So thank you is an important effort. And we're going to launch an effort thanking members of Congress in that regard this coming week. So we're going to do that. Second thing is we need to educate the new members of Congress. We have a Democratic-controlled House of Representatives. We have a new president coming on board. There's going to be new folks in the administration. The head of CMS is going to be new. We don't know who that will be yet. So we have to do some education right now, and the fellows can help engage with that effort. We can't slow down. We've got to be able to continue to communicate with our members of Congress and be able to tell them the important issues that are affecting surgical access to surgical care. And I expect that effort's going to continue this year.
So as individual fellows, what can we do to ensure that the goal, as it was so successfully realized at the end of 2020, will again be realized in 2021?
So a couple of things that you can do, and we try to make this as easy for everybody as possible. Those of you who participated by sending emails through our Surgeon's Voice on our ACS website know that you can do that any time of day, and it really takes about 30 seconds, a few clicks, and you've sent an email to your member of Congress. And we had over 16,000 emails sent in last year to the members of Congress on this issue from fellows of the college. And so we can continue to do that. Medicare physician payment is only one of many issues that we are working on and have worked on over the years. Trauma, we have trauma issues, we have cancer-related issues, a lot of access to care issues, military VA. We've got a huge agenda going forward. And so we'll be rolling out that agenda to everybody, so everybody make sure everybody's aware, but we need participation on all of these issues going forward. So that's one thing you can do. The other area that you can do is to get involved with meeting with your member of Congress. Now, we're in a virtual world. Very few people are getting on airplanes and flying to meetings these days, but we are going to have our Leadership and Advocacy Summit in May, and we'll be posting those dates mid-May, we're going to make it so that you can meet with your member of Congress right from your home, right from your office. We're going to do it virtually, and it's going to be a great opportunity to educate members of Congress and their staff about the issues. It's always a challenge for that meeting to be able to take a number of days off from practice to come to the meeting. We're going to make it very simple. The meeting will be over the weekend, so we'll prep you, and then on Monday, we'll set up virtual meetings for you to meet with your member of Congress and their staff. So these are some of the educational pieces that we can do going forward.
Well, those are good things to do, and I think people realize now that what we do in that regard can make a big difference. One area that people don't necessarily think about is the younger surgeons who maybe aren't as politically attuned, let's say. I mean, at least that's what many people say. The younger generation aren't joiners. They're in salaried models. What's the message to them? Because they are not only our future, they're our present. Not the people who are latter career, but the people who are early career, just starting career. How do we get them to understand the importance? Absolutely.
And everybody has different passions about particular issues that they care about. For some people, it's cancer-related issues. For others, it's graduate medical education and training programs. Virtually everything that surgeons do every day, whether that's in training or direct patient care or the like, is influenced by what happens in Washington. And there has been far too much involvement by Washington and far too much control, but I don't see that changing very much. And so we need to be able to educate those who are making these decisions. And if you're a young surgeon, if you're an older surgeon, where's your passion? What's your passionate issue that you care about? For some people, it's graduate medical education and training. For other people, they're in the trauma center, 18 hours a day, and they're true believers in the trauma care world that is so critically important in this country. But we need to do the education work so that the federal government and the state government is doing the best that they can do and not interfering with the care that is provided in all those sort of settings. So my best advice to everybody, young or old, is to find the issues that you're passionate about and bring those into the policy world and educate and be part of the process with that. You can easily do the clicks on the computer on any issue, and we critically need you on every issue. But to get deeper involved, I love when somebody feels passionate about a particular issue and they get involved and say, I want to teach my congressman about this issue. I want to educate the staff about this issue. I want to write about this issue. I want to be involved in the policy development about this issue. So that's what we need. We need sort of that passion and kind of use that at every level, at every age.
Well, passion, certainly part of it, time, and I will emphasize what you said. It is incredibly easy and super quick to send these emails. I mean, it's all teed up. It's, what's your name, what's your zip code, whatever, and it's done. And you get replies from the offices very quickly. Thanks for your note, we'll look at it. So it certainly does count. But the other aspect is the financial one. It's not an election year for Congress. So how does it stand in terms traditionally? How do we stand in terms of donations to our PAC in an off-cycle year?
The PAC is an important component, and I think people are very attuned politically to the fact that Congress is changing and things are happening here in Washington. So we need to engage everybody in the process, and we need you to write those checks to the PAC. We need you to be involved in terms of doing the grassroots work and being involved at that level. But we're going to need to educate the Congress right now, and we need to spend some time doing that, but we're going to need everybody's involvement in that. And we'll use all the tools that are available. You mentioned earlier the coalition is another effort in that regard. So we work with the political activity of the PAC, we work through grassroots, we work through coalitions, we work through education, communications efforts. All of these tools become the essential pieces this year. We used all of them last year in the campaign. Every one of those tools were important to the effort to stop those Medicare payment cuts. But I think those tools are going to be even more important this year going forward. I think there's a lot of uncertainty right now with the COVID crisis and what's going to happen on Capitol Hill and what they're going to do. We're going to keep our head forward and kind of keep on with these critical issues that we know are so important to our fellows and surgical patients.
Excellent. That's really good counsel for all of us fellows. Thanks again. I started by thanking you. I'll end by thanking you. It was really just absolute triumph in the 11th hour, as is always the case in DC. But nonetheless, it got done, and it got done. Thank you to you. Thank you to every single member of your team. Keep up the great work, and our job is to stand behind you and give you the help you need so that you can bring us the successes as you've done.
Thank you, and thank you to the fellows for the work that they did last year. We had a great team effort, and we need to keep on. So thank you, everybody, as well.
We're in this together. One day in person again.
Exactly.